The amount of vaccine we will get will likely be, at least initially, over several 100,000 doses, although that may change, and we will be getting that in several tranches weekly, but we may have additional available. So I'm not giving you an exact number because I expect that those numbers may change over time, and we actually may have additional vaccine available depending on kind of overall national supply. The other thing I thought was important to emphasize is the fact that with the limited vaccines initially available, we felt it was very important for us to follow the ACIP guidelines. That's the advisory group to CDC on immunization practices. ACIP is an independent organization. It's not a government entity, and it looks at not only the science but all the ethics of who needs to be vaccinated first. And we have chosen to follow ACIP here in Georgia rather than kind of go on a separate course. And I think that will allow us to provide vaccine initially to the most vulnerable, as well as those who are most at risk because of the work that they do. And so following ACIP guidelines, this initial tranche of vaccine that becomes available in the next several weeks will go immediately to healthcare providers working through largely through the hospital system as well as our public health system, and long-term care facilities, both their staff as well as the residents, recognizing how many individuals have been affected in those facilities. In the next round after that, we hope to not only address the needs of essential workers, including, for example, nuclear power plants, the power facilities, those individuals that keep our state running, as well as older individuals over 65 with multiple health conditions who may be at higher risk for complications. But we have to wait for the ultimate guidelines to come out from CDC, and they'll be coming out in the weeks ahead. We expect to have both a combination of the Pfizer and the Moderna vaccine. Again, there are two different vaccines that we hope will become approved by the FDA through an EUA, through an emergency use authorization in the next several weeks. The Pfizer vaccine requires -90 freezers. We have those freezers available all over the state. I have identified them as well as have purchased them within public health and have worked out a mechanism to transport vaccine even without the freezers through special carriers that Pfizer has provided in partnership with the vaccine program. The Moderna doesn't require that those the deep freezers, it's a regular freezer, and so that'll be easier to transport. We'll be working in partnership with the Georgia State Patrol to transport that vaccine to the various facilities, whereas the Pfizer vaccine will be transported directly to hospitals, for example, that may be providing those vaccines to their healthcare workers. And we'll be able to provide more details on that if you're interested.